We've understood that insulin helps to manage diabetes and prevent other complications. But still, while starting insulin, patients are having few more worries such as, how do I inject insulin?
So suppose when you are starting the first time for any patient insulin, first thing we need to do is, any doctor need to do is patient education. So we have to remove that stigma, that fear of the patient to start insulin. So patient education is very important, awareness. So the team should be there readily to imply what is the benefit of insulin. So not to scare of the risks of the insulin. So injection technique and because improper technique, suppose the patient is not using this properly, the technique is wrong. So whatever insulin for 2 months or 3 months he's taking, it's waste only. So we can't achieve the target. So for any successful insulin therapy, the technique is very important. So you have to better to use short and thin needle. So 4 mm needle. So we have to inject subcutaneously, so into the fat, not into the muscle. So 90 degrees perpendicularly we have to inject, because many times we'll be seeing 45 degrees angle. So perpendicular thing is very important. So first we have to wipe off with the alcohol swab, and then you have to inject into the subcutaneous fatty layer. So, and best thing is to hold it for 6 seconds. So immediately don't withdraw it, any pen or any vial. So we should not withdraw. And important thing is rotation of the sites is very important. So next question comes, where the insulin to be taken? What is the best site? So see, best site for insulin absorption, good absorption is abdomen, over your abdomen. So 3 fingers away from the umbilicus, you can give anywhere of the abdomen. So, but site rotation is very important. At least 1 centimeter gap should be there between from the previous site. And the next important site, thighs, front and lateral part of the thighs or arm. So these are the most commonly used sites. So rotation of the sites is very important. Why? Because suppose you are injecting over the same site, it may lead to lipohypertrophy. So that is the fat deposits, lumps may form. So which we have to watch carefully. Suppose any lump is there, any fat deposit is there. So you don't inject insulin over that area. You avoid that area till that lump disappears, till that fat disappears, because it may lead to erratic absorption. Okay. So suppose you are using mixed insulin. So pre-mixed insulin, there will be clouding. So we have to roll. We have to roll. If any clumps they are not dissolving, you should not use that insulin. And better to use before 1 month. After you open your vial. So after 1 month, better not. First check your expiry date. So last but not least. So that these are the very important. And coming to reusage of the needle. See, this is the common thing I'll be seeing. So don't please reuse the needle, same needle every 3 days, 1 week, like that. See, whatever syringe or needle. The ideal time is 1 time. You know that? So 1 time. What happens if you reuse the same needle? What happens? It will damage your tip of the needle. So it may cause injection site pain or bleeding, or that may lodge under the skin. The fragments may lodge under the skin. And last but not least, please don't share the syringes or pens with your neighbors or your other family members, because it may contaminate. So you get contaminated with the hepatitis B or HIV virus. So, and the another most important thing is insulin titration. So what is this titration? Dose adjustment. So your doctor will help you. You have to discuss with the patient regarding the dose adjustment. So don't be in a hurry to over titrate, like so first 2 weeks very crucial once we start the insulin therapy. So we have to regularly monitor your blood glucose. Everyone should have glucometer at their home, so that they have to check their sugars at least 4 times per day, 3 times pre-meals and 1 bedtime. Suppose if your glucose target, better to maintain like fasting 90 to 130 and post-prandial like 140 to 180. Suppose if you are above the target, so you have to tell your patient, or you can adjust the dose by through the phone. So 2 to 4 units per time you have to increase, not like 8 units, 10 units. So don't do over titration. It may land into because the patient may land into hypoglycemia, which is very risky. So you have to tell this caution to your patient. So hypoglycemia is one of the common complications. So hypoglycemia, suppose any patient develops hypoglycemia, what to do? So they have to be readily glucose tablets or glucose or sugar. So then from the next day they need to reduce the insulin dose or consult your doctor. So monitoring the blood glucose levels and warning signs about hypoglycemia is very important. You have to educate this to your patient.